Hello, happy people, and welcome back to another episode of 65 and Counting. I'm your host, Adam Fry. I'm a certified Medicare planner, and I'm here to ask the important questions that you want answered by industry professionals. This show is for everyone and anyone coming up on that important milestone of 65 years old. That means retirement, it means Medicare eligibility, or it means that you're just plain interested in the world of retirement planning. Whatever it is, on this show, you'll hear from the people that know it best. Hello and welcome back. This week, we're going to shine the educational spotlight onto a type of Medicare Advantage plan available to individuals who meet certain requirements. But everyone should listen because you may have a loved one who could use some help. We're talking about special needs plans. What are they? Who can have one? And why would you want one? We can break down special needs plans into three different categories. There are chronic condition special needs plans for our friends with qualifying chronic conditions. There's dual eligible special needs plans. These are for our friends who are on both Medicare and Medicaid. And then there's institutional special needs plans for our friends who are living in specific kinds of institutional settings. And they all include prescription drug coverage. Special needs plans at their roots are limited to people who meet specified criteria. We'll break down what they do and who can have them now. So let's start with chronic condition special needs plans. Certified Medicare planners like me call them CSNPs or CSNPs. And they're limited to people with special medical needs relating to specific severe or disabling conditions. These types of plans were developed because research found that approximately 2/3 of Medicare enrollees have multiple chronic conditions that require coordination of care between primary care providers, medical and mental health specialists, inpatient and outpatient facilities, and extensive extra services related to things like diagnostic testing, therapeutic management, and even expensive medications. There is a long list of who can get one of these plans, but the most common conditions we have found, they're diabetics, they're people with heart care needs, people with lung care needs, and kidney care needs. So there's chronic condition plans for all of those different conditions. These plans can also help with the high cost of insulin and other medications related to the chronic condition. If you think you might be eligible for one of these plans, get with a certified Medicare planner to check your options. The next type of plan is a special needs plan called Dual Eligible Special Needs Plan, or DSNP or DSNP. These plans are for individuals who are entitled to both Medicare and Medicaid. These kinds of plans vary widely from state to state. They provide individuals Medicare and Medicaid benefits under a single managed care organization. These programs are designed to give assistance with Medicare premiums and cost sharing. And this assistance with premiums and cost sharing is also known as a Medicare Savings Program. And they generally fall under four categories. The first of which is a Qualified Medicare Beneficiary, or QMB. In this category, the program will help pay premiums, deductibles, coinsurance, and co-payments for both Part A and Part B. That means that when a qualified Medicare beneficiary enrolls into a Medicare Advantage plan, they do not have to pay more than the cost sharing what any minimal co-payment would be under Medicaid. The next category is a Specified Low-Income Medicare Beneficiary Program, or SLMB, and that helps pay the Part B premiums along with the Qualifying Individual or QI program. The Qualified Disabled Working Individual, or QDWI program, will pay the Part A premium for certain disabled and working beneficiaries. So, these kinds of plans can be quite beneficial to anyone with a qualifying low income. And like I said earlier, meeting these qualifications can vary greatly depending on which state you live in. So it varies from state to state. If you think you might be eligible and would like to dive deeper into DSNPs or dual special needs plans that could be available to you, get in touch with the Certified Medicare Planner. Finally, there are institutional special needs plans, or ISNPs, or ISNPs. These types of plans, they're limited to Medicare eligible people who for 90 days or longer have had or expected to need the level of services provided in a long-term care facility, or an intermediate care facility for mentally disabled, or an inpatient psychiatric facility. There's also special ISNPs for those people who still live in the community, but they require the level of care that you find in an institution. Another great thing about these ISNP plans is that the enrollment period for these plans is continuous. That means that as long as someone is institutionalized, they can continue to change plans for the duration of their stay up until 60 days after they no longer meet the definition of institutionalized. Most likely, people who qualify for ISNPs are going to have a state-appointed power of attorney making decisions about their insurance. So, if you believe that your loved one may benefit from this, get in touch with one of our certified Medicare planners to help make an informed decision. Wow. Whew. That was a lot of information. I'm going to cover each type of these special needs plans in the coming episodes on our educational spotlight specials. But that's SNPs in a nutshell. So thank you so much for tuning in. Don't forget to follow our page, like this video, and share it with all your friends. And as always, have a great week and a happy holiday.